General George Patton, a hero from World War II, portrayed by George C. Scott in the movie, had said famously that Americans love a winner, and Americans love to win. And so it is probably not surprising that Americans also love to gamble. And while some are focusing on who will be the big winners during the World Series between the Astros and the Phillies for the coveted championship pennant, as well as the critical midterm elections and the fate of democracy, others of a more gambling spirit are pinning hopes on becoming a winner for just $2 in the $1.6 billion Powerball jackpot, where they have a 1 in 292,201,338 chance of waking up surprised as a billionaire. For those who prefer percentages, that translates into considerably less than a 1% chance of winning, or for those who like numbers, a big zero followed by a decimal point and like 9 more zeros before you see a larger number like 3 followed by some more numbers. A very remote chance in which you'd fare far better taking a bet on a coin toss. And believe it or not, a recent study, promoted even in the Atlantic, but using metadata analysis and examining a total of 139 household trace contact studies, households where your chances of becoming infected with a highly contagious disease have the most optimal chances for success. That study had calculated that you would have a far better chance of winning a coin toss than catching the dreaded Omicron variant, the most transmissible variant yet, from your cohabitating roommate, with whom you live, breathe, and speak each and every day. And for those who served this nation in the U.S. Army Reserve, you may recall an interview on January 11th, 2021, when Lieutenant General Jody Daniels, the commander of all Army Reserve forces, had said, even before the first anniversary of the pandemic and the American Rescue Plan, and under a month after the Pfizer products had become for the first time available in December 2020, she had said, the vaccine is supported by science. If I play roulette and contract the virus, I could be asymptomatic or on a respirator. I don't want to risk finding out where in the spectrum I'll fall. I want to protect myself, my family, and my coworkers. And at Fort Bragg, North Carolina, even before General Lloyd Austin's message to the force that would follow later on August 9th, 2021, General Daniels took a photo opportunity to encourage others under her command to also get the shot. General Daniels, a native of Rolla, Missouri, the Show Me State, had made history as the first woman to command the U.S. Army Reserve, assuming the duties of the 34th Chief of Army Reserve and the 9th Commanding General, U.S. Army Reserve Command on July 28, 2020. After most recently serving as the Commanding General, 88th Readiness Division, Fort Snelling, Minnesota, and about 2 decades ago, she had served as my battalion commander in the reserve component in a drill sergeant unit, tasked with the mission to assist in the conduct of basic training, brand new former civilians becoming soldiers, as well as supporting the summer session at the United States Military Academy at West Point, teaching young cadets become commissioned officers to lead. Mission first, men always before myself. So I know the general pretty well in a personal way. And if you were to read her biography, you would know that she had assumed command with a very impressive resume as a graduate of Carnegie Mellon University, where she earned a BS in Applied Mathematics, Computer Science. And she holds a master's and PhD in Computer Science from the University of Massachusetts at Amherst, as well as a master's in Strategic Studies from the United States Army War College. She has formerly served as the Chief of Staff at the U.S. Army Forces Command, FORSCOM, now headquartered at Fort Bragg, North Carolina, as well as serving formerly as the Director, Intelligence and Knowledge Development Directorate J2 for U.S. Africa Command, and as Assistant Chief of Staff for the U.S. Africa Command, and commissioned as an intelligence officer at Fort Huachuca, Arizona, like myself. General Daniels is very familiar with the process of intelligence preparation of battlefield, IPB. The war is won before it is fought, and knows far better than anyone that intelligence, good information, establishing ground truth, boots on ground, eyes on the objective to obtain a clear picture of the threat, drives the mission cycle. Or to use the phrase from her former civilian profession as a computer scientist, focusing on an artificial intelligence at Lockheed Martin, gobbledygook in and gobbledygook out does not sound like a success story. A sentiment reiterated by Defense Secretary General Lloyd Austin when he had been in command of CENTCOM, the first African American to ever hold that position, assuming that command at just the age of 59, back in 2012, telling reporters at CBS News on September 22nd, 2016, after a breaking scandal at CENTCOM regarding intelligence, that we can't make good policy unless we have good, accurate, clear-eyed, hard-headed intelligence. September 22nd, 2016. As CENTCOM commander, during a breaking scandal, the Secretary of Defense, who had ordered all members of DoD to get the shot on August 9th, 2021, said we can't make good policy unless we have good, accurate, clear-eyed, hard-headed intelligence. And that seems to conform to common sense. September 22nd, 2016. That was the opinion of the current Secretary of Defense when he was the commander of CENTCOM. September 22nd, 922. Remember that number because there may be a test. Hello, my name is Major Mike Webb. About 3 decades ago, as a U.S. Army intelligence officer, I had an incredible opportunity and enjoyed uncommon luck, hitting the jackpot to serve as just a lieutenant. 02. In the capacity of both aide-de-camp and later the operations officer for all U.S. Army strategic counterintelligence in the continental United States, which some describe as the lower 49, the most junior commissioned officers who have ever served in that role, usually reserved for a senior captain. And there I had played a critical staff role in the formation of the Armed Forces Medical Intelligence Center, or AFMIC, the precursor intelligence activity to the National Medical Intelligence Center, or NMIC, which in April 2020, George Stephanopoulos, James Gordon Meek, and others had claimed to have provided an early warning to the former president by November 2019 of an emerging public health crisis in China, vicinity Wuhan, based upon covert interception of communications. A story that quickly faded away, however, from the headlines after George Stephanopoulos and his wife were reportedly infected with the novel coronavirus. Coincidentally, at a time when I was beginning the very first and longest surviving litigation challenge against the lockdowns. Certainly coincidence, certainly of anecdotal value, but in intelligence, just like in stage illusion, things are not always as they appear, and Sun Tzu says that all war is based upon deception. And you look like an intelligent person. Call it serendipity, call it fortuitous, or call it providential. That was simply how the cards were dealt. But at least Dr. Richard Feynman, a former professor of astrophysics at Harvard University, was pretty certain in his book, Surely You're Joking, Mr. Feynman, that a gambler makes a living as a gambler not by relying upon dumb luck, but rather always makes his luck, a rule to which he includes never bet with your own money. And as Kenny Rogers said, every hand's a winner and every hand's a loser. You gotta know when to hold, know when to fold, know when to walk away, and know when to run. And today, in addition to running for a house in a seat in the state legislature in the 49th district, I have had a total of a half dozen actions brought against the government response to the current public health crisis, popularly called the pandemic, docketed at the United States Supreme Court in under a year. And in the meanwhile, my defendants have had the curious habit of becoming infected with COVID-19 and surviving at the most convenient times. Dr. Ralph Northam, Dr. Anthony Fauci, and now even Dr. Rochelle Walensky, all who have been named as my defendants, have been infected by the novel coronavirus, at least according to reports in the press. And as Dr. Fauci is planning to retire now in December, some may have heard the reports in the news. The pandemic is over, Biden told Scott Pelley of CBS as they walked around the Detroit Auto Show last week. We still have a problem with COVID. We're still doing a lot of work on it, but the pandemic is over. And at least according to The Atlantic, the pandemic may have decreased in intensity. But with every passing week, we still have the equivalent of a 9/11 in death toll in the United States, where we continue to lead the world in fatalities, accounting for over 43% of the daily fatalities to a novel coronavirus. A novel coronavirus has been attributed to over 6.5 million fatalities worldwide, more fatalities than the Holocaust and in half the time, as well as over 1 million American fatalities. And as Dr. Ralph Northam had reminded Virginians after he had departed office, there remains the lingering problems associated with long COVID, an affliction affecting over 23 million Americans, over 1 million of whom can still not return to work, while over 97 million cases of COVID-19 have been reported in the United States, of whom at least as many as 12% represent reinfections for persons who appear at least to have a better chance of coming into contact with the invisible enemy than others, in uncommon luck. But researchers have found such prior infections not to be associated with acquiring natural immunity, as some had previously and continue to believe, but rather are associated with a far higher risk of adverse outcomes such as hospitalization and death. So perhaps the greatest existential question to answer in this big casino gambling game, with so much remaining unknown about the virus, for which, at least according to the president, a pandemic is now over, is, do you feel lucky? You look like an intelligent person. A recent working group paper from several Yale professors at the National Bureau of Economic Research, NBER, had reported the finding in September that in the COVID pre-vaccine period, it's a quote, the association between excess death rates and county-level vaccination rates are nearly identical for Democrats and Republicans. Pre-vaccines, nearly identical. However, in the COVID post-vaccine period, they found there is a clear visual difference between Democrats and Republicans, reporting far higher excess death rates for Republicans in counties with lower vaccination rates. And the immediate suggestion from this visual representation is that while examining only data available in the states of Ohio and Florida, Republicans who had refused the vaccine, opposed to Democrats who had volunteered to be administered the vaccines, faced higher fatalities, although they conceded, noting that things are not always as they appear, that they were only examining county-level general statistics, not individuals, and could neither confirm nor deny that the actual deaths in those counties were associated with personal vaccine status. So there is a stated limitation in the report regarding the conclusions that might be drawn from this data and analysis. The excess deaths may have been unvaccinated Republicans, but the researchers from Yale could not state that for sure. And we like to bet on sure things, to be big winners at the casino. But they did assert specifically that this sharp contrast in the excess death rate gap before and after vaccines were available appears that vaccine take-up likely played an important role, implicitly conceding, however, that all other prevention and mitigation strategies which many adopted based upon the data had failed, to include social distancing, lockdowns, and mandates, which closed schools, churches, and businesses, and which by April of 2020 were the equivalent, according to Axios, of a Hurricane Katrina in every state. Masks, determined a decade ago by NIOSH to be wholly ineffective in a respiratory tract infection pandemic, using the very same diagnostic equipment that is used to rate the N95, the gold standard of medical grade protection for public health workers. Made, according to these Yale professors at NPR, absolutely no statistically significant difference in mortality, nor did shelter-in-place orders and lockdowns, which Dr. Fauci had strongly advised during the beginning of the pandemic, but which even the WHO had established in 2006 during their work study examining pandemics all the way back to the Spanish flu pandemic of 1918, and a conclusion that had been reiterated in February 2020 after an examination of 19 times more confirmed cases in China than had yet been reported by mid-March in the entire United States, that they would be ineffective. An examination conducted by 1,800 teams of at least 5 epidemiologists, which would appear to be a rather credible study. But in September, they, at NBER, Yale professors reported, at least tentatively, that it at least appeared that the vaccine products had been effective in preventing fatalities for those who had complied with the mandates, while those who had refused the mandates had suffered the consequences and died. Or at least that was how it had appeared. As noted by the Data Institute at the University of San Francisco, during the beginning of the current public health crisis, which the president has declared over, pandemics are historically associated with fear, confusion, and despair, which tends to place most persons at the mercy of the pandemic and those responsible for prevention and mitigation, even if everyone has a part. And recall that on September 22nd, 2016, General Lloyd Austin, then the commander of CENTCOM, during a scandal regarding intelligence, had assured Americans that we can't make good policy unless we have good, accurate, clear-eyed, hard-headed intelligence. And on September 22nd, 2022, just 6 years later, while Dr. Francisco Duran, the superintendent for the Arlington Public Schools, had prioritized galvanizing the community response against the modifications to the transgender policy and had taken a vow to protect the members of the LGBTQI community and their preferences for personal pronouns, choices of restroom facilities, and participation in athletics because he wanted to protect their dreams. A peer-reviewed report published in the Vaccines Journal had reported the associated risk with the mRNA vaccine products that superintendent in the community with the most government scientists, who holds a doctorate of education from Columbia University and who had in May 2021 organized a 3-day-long event to ensure the safety of the schools he manages, providing free vaccines to all staff, administrators, and faculty, providing, like General Daniels, a leadership example and a photo opportunity to be administered the vaccine product live during a videotaping of the event. But what Dr. Duran, the Arlington Public School Superintendent, did not make a priority at that meeting or even later was that report had established an associated risk of 16% for serious adverse events, to include death, incapacity, birth defects, and other medically significant events, as high as 33% for those who, like the black clergy, had encouraged for their parishioners, 33%, all for a chance to avoid infection from that disease that has infected less than 1% or 0.0003% of Americans, including reinfection, up to 12%, in which over 75% of the fatalities have been at least age 65 with at least 4 comorbidity factors, according to the CDC. So, essentially, like General Austin and General Daniels, Dr. Duran had advised that persons accept a 16% risk of loss to avoid a fatal outcome, that less than 2% of Americans, most of whom have identifiable high risks known from the beginning, to have become fatalities. And this he also promotes for children for whom he is going to protect personal pronouns. And you look like an intelligent person. This briefing is unclassified. As you were, carry on. Honest.
This advertisement was authorized by Mike Webb.